topic of assessment and prevention and management of antinoplastic-related diverse drug event, we have seen about the upper GI complications, upper GI adverse drug reactions, nausea and vomiting, mucositis. But we cannot forget or let it go like this. We have the lower GI complication. Lower GI complications include diarrhea and constipation. These things can happen in the same client. Don't forget, can happen in the same client. The same client can experience in some time, diarrhea, and sometimes can come with it, can say, I have constipation. And sometimes you can get confused. How could constipation and diarrhea occur at the same time? Or can occur in the same patient? And sometimes not likely, but in the same patient. Another is if the patient cannot respond by using maybe ORS or giving the Ringer's lactate and others, you can use the loperamide. 4 milligrams start, and then you can use it 2 milligrams even after one run. So every patient can get diarrhea, the 2 milligrams of loperamide can be used or it can be used 2 milligrams in every 12 hours or every 2 hours until 12 hours. This is how we can see how the complication of long-term use of antinoplastic medication in our client. But this does not stop us using the antinoplastic medication because it produces a lot of advantage to our client in cancer progress. It produces a lot of advantage in cancer treatment, and have many advantages. And having the adverse drug event to our client is not a reason to stop treatment. But we cannot let our client to suffer a lot from the adverse drug event. We have this medication which I mentioned here. We can use them, we can advocate, we can advise on how to be compliant together when the patient is on the antinoplastic medication. Our role, we have to protect our client from the noxious side effect or adverse event due to the long-term use of antinoplastic. There are some patients who cannot respond also using the loperamide. This is when you can use somatostatin analogs, which is the octreotide. Octreotide can be used to manage diarrhea, but in this time, octreotide can be used together with the intravenous proton pump inhibitor like pantoprazole or rabeprazole. They show you the good result when the patient have the very severe diarrhea. It is acute, it's for a long time. It's when we can use it for a long time. Use after 24 hours, the patient continue to do diarrhea. Lose of a lot of water is when we can intervene with using octreotide and the proton pump inhibitor. And don't forget, when the patient stops diarrhea, you can shift the patient to oral loperamide and the proton pump inhibitor. The parasympathetic stimulation, which is normally aggravated by the acetylcholine and the cholinergic symptoms, which lead to the salvations, meiosis, lacrimation, production of saliva, the production of the tears, production of a lot of the fluid in GI. This can lead to the diarrhea also within the 24 hours. And the prevention normally in early onset prevention, for we clinical pharmacists, atropine produced better result than using the loperamide in prevention of all early onset diarrhea due to the irinotecan. So we prefer using the atropine intravenous or subcutaneous of 0.25 to 1 gram or dose of atropine. To many infection, sometimes the infection can be together, can be the chemotherapy induced at the same time, can be due to the infection which is normally aggravated by long-term use of chemotherapy. And here we have many medications which are normally related to the diarrhea, but the most fundamental drugs, the most culprit of causing the diarrhea is irinotecan. Irinotecan is medications, antinoplastic medication. It can cause diarrhea, and this can be early onset or late onset diarrhea. The diarrhea which is coming as quickly after using irinotecan. Some diarrhea can occur after using the irinotecan, 24 hours or before 24 hours. 24 hours within the chemotherapy of using irinotecan, or 24 hours after the using of irinotecan. Our role as a pharmacist, our role as a clinicians and a clinical pharmacist, we have to make our patient to be happy even if they are using the very dangerous drug, maybe the very peculiar medications like the antineoplastic medication. And this how to treat side effect is our role. How to advise how to treat side effect is our role. The lucky enough, maybe the cancer therapy is only therapy whereby there is another drugs which is going to treat the effect of another drug. You have the antineoplastic drug, but we have the medications which are there to treat some noxious effect due to the antineoplastic medications. This can be very different from the other practice, like with the vascular system, maybe different from the dermatology, but in cancer we are lucky. I warmly welcome you to this class in the 2nd of October and the 6th of October to attend my class on the how we can prevent, manage and assess antineoplastic adverse event in clinical pharmacy perspective. Thank you, I love you.